It's hard to say exactly. I mean, we certainly see these kinds of food trends happen often, lactose intolerant, gluten-free. When you talk to doctors, you hear that over the last 5 years, this is certainly something they're seeing more and more often. Patients coming in saying, I have gut problems, I'm trying this gluten-free thing, what do you think of it? When you look at historically what the public health messages have been, it's really interesting too. For a long time, there was a real focus on low fat, sugar-free, so people started turning towards things like carbs. There was a real emphasis on the importance of whole grains. And then we started to see obesity rates creeping up. And the message became often low carb, like we should pull back. And so that is probably tied up in some of this gluten-free thing, but part of it also is just the fact that that gut symptoms are so ubiquitous. I mean, people have them all of the time. It's the most common symptom people come up to their doctor with. And so when you hear that something like not eating gluten might help, of course you're going to try it. Well, there's no harm at all if you have a disease like celiac or if you have a wheat allergy. In those cases, you should absolutely avoid gluten at all costs. But you can only know if you have these things if you've gone to your doctor and have been tested. The problem with going gluten-free without going and talking to a healthcare professional, be it your doctor, dietitian, or naturopath, is that you don't really know what the problem is, why you're having these gut symptoms. And so in adopting a gluten-free diet, you are basically foregoing the kind of guidance that might tell you if this is really the problem. The other thing is a lot of times gluten-free foods are really quite unhealthy. They aren't fortified, they lack vitamins, minerals, fiber, so a lot of people substitute these foods into their diet and they're missing a lot of important other components, and so that's also a really big problem. They can also be higher in fat, lower in protein, so there's a whole sort of slew of reasons why people should really be first talking to their doctor before they're going on this diet and finding out if it is in fact what they really need to be doing. This is actually fascinating to me because, when it comes to health problems, everyone knows that going on the internet is one of the most dangerous things you can do because you can find so many scary stories and suppositions about what might be going on with you. But when we talk about gluten-free, we really do see this hugely active online community. There are so many different blogs devoted to going gluten-free, extolling the virtues, talking about different recipes. You can go on databases that suggest really great restaurants. And also in social media, you have this culture of sharing. And so people talk about their own experiences, and if they've had a really positive one, you might get wind of that and think, well, maybe I should try it too. Another really interesting aspect of this is that when you talk to people who have celiac disease, but where they get a lot of their information about their health, very few of them, only about a quarter of them, say they talk to their doctor. They get their information from their doctor. It's all about the internet. And when you talk to someone like the author of Wheat Belly, that hugely popular book that really was at the center of this a few years ago, even he credits a lot of the popularity of going gluten-free to social media. So it's a fascinating phenomenon. I think there's a lot of value in having that network online, but I think there can be some confusion to be had because of it as well.